All right, well, my name is Karen Davis. I'm actually a volunteer with Hemophilia of North Carolina. Hemophilia of North Carolina has been in serving the bleeding disorders community throughout the state since the 1970s. Bleeding disorders are when people have some factor missing from their blood and their blood does not clot normally, and it can lead to many different types of complications, from severe to mild. So as an organization, Hemophilia of North Carolina serves its community through patient advocacy, education, retreats, peer support groups for families, women, teens, the Latino community, and also connecting them with providers in their hemophilia treatment centers and hematology centers around the state, working directly with them to make sure that we're in providing services that complement what they're doing at the medical level. So as far as volunteer opportunities, it's a statewide organization, as I mentioned. The office is in Morrisville. So there are some in-person and some remote opportunities that I'd like to review for you today. The contact information on the slide is for our program director, Jillian Schultz. And the website in the first bullet item is our first volunteer opportunity. And we have an in-person outdoor event planned for October 2nd at Lake Crabtree Park in Morrisville. It is a 5K walk, but also a family festival. And there's a lot of opportunity for a group to do a service project or even individuals to come. It's a good way to learn more about the community, meet people within the community, and hear a lot about what Hemophilia of North Carolina does as outreach to the community of people with bleeding disorders in North Carolina. So the volunteer registration form is online, and you can see the link on the slide, or if you have any questions, you can feel free to contact Jillian at the email address on the slide. After that one-day event in October, there are several different things that one might be able to help with. Very important in serving the entire community of people in North Carolina would be Spanish translators. As of this time, we don't have any Spanish-speaking staff members, and we have a few volunteers. But we have materials, we have a quarterly newsletter, we have many things that we want translated into Spanish so that our Spanish-speaking members feel just as part of the community as English-speaking members. So if we have any Spanish translators out there who are interested in doing remote work, that would be something that would be open to them. Our public health and community outreach assistance can be done either remotely or at the office in Morrisville. Public health advocates or assistants would work with the staff in their outreach to other healthcare workers, maybe going to man a booth or at a professional organization conference, maybe a nurses conference or an obstetrics and gynecology conference or some other type of conference to try to spread awareness about people with bleeding disorders and how they have special needs in terms of their medical care. Community outreach assistants could assist with anything from writing thank you cards or birthday cards, helping get information out to members of the community, and work with the staff in trying to do more community outreach. Office work or remote work, sometimes donor research assistance, website assistance, proofreading. There are so many different things that are just regular old office work, but they all need to get done. And we have mailings and different types of things that can be done at the office. And if you have a special thing that you are studying or you want to take on and you think it might be a good fit for a small nonprofit for somebody with chronic diseases, if that's an area that you are interested in getting involved more, then and you have something in mind, the staff is always open to working with you on special projects because sometimes that can be mutually beneficial. Also not listed here in the advocacy efforts, if we have advocacy days in Raleigh and in Washington, D.C., and just helping put those things together, and other events and outreach programs. And when we are fully in person and indoor events, there are retreats and other things throughout the year, throughout the state, that always need some help in planning. So event planning is also another thing that could be done at the office or remotely. And that really does cover it. If anybody has any questions, I'm happy to answer them.